Ginger has a long history of clinical use. Studies show it is highly effective at managing systemic inflammation, reducing nausea, and regulating blood sugar. But most people treat it like a simple flavor enhancer. They chop it up, throw it into boiling water, and accidentally destroy the very medicinal compounds they are trying to extract. They also take it first thing in the morning without food. This often leads to a harsh gastrointestinal backlash, leaving them with severe stomach cramps and heartburn. To get the physical benefits, you have to follow 3 specific steps. First, you need to select the correct chemical form of the root. Second, you must use a temperature-controlled brewing method. And third, you have to establish a safe, strict daily dosage limit. When you apply these strict preparation protocols, you stop making flavored water. You transform a common culinary ingredient into a precise, functional tool for your health. The specific health benefits you get from ginger depend entirely on how the root has been processed before it reaches your kitchen. Inside the raw, fresh root, the primary active compounds are called gingerols. These are excellent for settling digestive issues and stopping acute nausea. However, when you dry the root or expose it to sustained heat, the molecular structure of the ginger changes completely. The drying process converts the gingerols into a new compound called shogaols. This new structure is significantly more potent when it comes to fighting severe inflammation throughout the body. Once in your system, shogaols act as natural COX-2 inhibitors. They target and suppress the exact same inflammatory enzymes that over-the-counter pain medications are designed to block. Here is how that transformation works. Fresh gingerol on the left morphs into the shogaol structure on the right. Once in your bloodstream, that shogaol molecule locks directly into the COX-2 receptor pathway, shutting off pain signals sent to your joints. So using fresh ginger to treat chronic joint pain is a chemical mismatch. If you want functional results for inflammation, you have to use the dried form to access those shogaols. To extract these compounds correctly, we look at the traditional Kashmiri Kevwa brewing technique. They use a heavy metal samovar, like this one, to apply sustained, controlled heat over long periods, rather than a rapid boil. Today, the most common mistake people make is chopping up their ginger and dropping it straight into water that is boiling at 100 degrees Celsius, or 212 degrees Fahrenheit. That violent maximum temperature heat physically fractures the delicate volatile oils. It destroys the medicinal compounds before your body ever gets a chance to absorb them. To fix this, you need to implement the 90-second rest rule. Take boiling water completely off the heat and let it sit for exactly 90 seconds to reach the optimal extraction zone of 95 degrees Celsius. Only then do you add your dried ginger to the rested water. Let it steep for 3 to 5 minutes. This provides enough gentle heat to fully pull out the desired compounds without breaking them down. Strict temperature control is the absolute dividing line. It dictates whether you are brewing a pleasantly flavored beverage or extracting a potent biological remedy. Because we are treating this as a medicinal tool, we have to talk about limits. You should never exceed a strict daily maximum of 4 to 5 grams of ginger. You also need to follow the empty stomach rule. Consuming potent ginger extracts without any food in your system acts as a severe gastric irritant, triggering cramps and acid reflux. To prevent this, just pair your tea with a small snack, like a handful of almonds. This builds a physical buffer along your stomach lining. We also have to address serious medical interactions. Ginger is a natural blood thinner. If you take pharmaceutical blood thinners, like warfarin, adding ginger to your routine presents a severe interaction risk. There is a secondary warning for anyone with gallstones. Ginger naturally stimulates the liver, leading to excess bile production that can aggravate gallbladder issues. Because of its powerful blood-thinning properties, there is a non-negotiable rule to stop therapeutic ginger consumption 2 weeks prior to any scheduled surgical procedures. Ginger actively manipulates your cardiovascular and digestive chemistry. Because of that, it must be dosed and respected with the exact same caution you would apply to a pharmaceutical drug. To summarize the protocol, always use 95-degree rested water, stick to a strict 5-gram daily maximum, and never consume your brew on an empty stomach. To integrate this into your day, try scheduling your tea for mid-morning or mid-afternoon. This keeps food in your stomach while proactively managing your systemic inflammation and acute nausea throughout the day. If you found this breakdown helpful, make sure to subscribe for more evidence-based guides on functional nutrition and natural therapeutics. By respecting the underlying chemistry, controlling your preparation methods, and strictly honoring the dosing limits, you can safely harness this ancient root for modern health optimization.